By the end of this video, you're going to have a 5-step guide to understanding the difference between hip dysplasia and hip arthritis, what to do for both, and how they get started in the first place. Hi, I'm Pet Doc Donna, and I've been a holistic vet for over 30 years, so let's start getting your pet feeling better now. Just a heads up, please don't skip any of these 5 steps. If you skip any of them, your pet could be afflicted with the pain and discomfort of hip dysplasia and hip arthritis longer than you'd like, so don't skip any of them. Step 1, know when to use laser therapy. So there's a difference between hip dysplasia in young dogs, which is a genetic situation where there's more than 50% of the hip joint, so the head of the femur is out of the joint, more than 50%. That's genetic, that's in a young dog. You might see limping in a young age, you might see discomfort at a young age, and sometimes those guys are honestly better off with total hip replacement or surgery. And then there's hip arthritis. So hip arthritis might happen due to an inflammatory diet, maybe due to partly genetics, partly diet, partly lifestyle, right? Because we have a dog that we shouldn't really be running on the concrete, and we're running the dog like 6 miles a day on concrete, and then we're wondering why he's limping, you know, a few days later or the next day.
Is that arthritis or dysplasia?
There's arthritis in there.
Okay.
The dysplasia is more like it's what we're born with. It's like, I should say, hopefully we're not born with it, but the German Shepherds are notoriously born with it. Just like their hips are more than 50% out of the socket. But, you know, having said that, the old treatment for it was to cut off the femoral head. They just cut it off. Yeah, it was so crazy. So basically they took the bone on bone away. The dogs didn't walk really normally, but they did get free from pain really quick. And so that was the old treatment. It's like, let's just cut it out if it's not working. But it actually wasn't too bad. And so what happened was the muscles would take over. It just shows you how important the muscles are in that area and the connective tissue. So hip arthritis is different than hip dysplasia. I want you guys to know the difference. And also when laser therapy is great. So laser therapy is safe. You can use it in either case, but I think it has a little bit more effect in the hip arthritis situations. You could do laser at home, and you could do it up to 3 times a week quite safely. Just make sure you protect your eyes and you protect your pet's eyes, right? Usually they have little sunglasses for both of you. You don't want to be looking at the laser. The laser could hurt your eye, your retina. So anyway, it reduces the inflammation. It helps with the joint motion and mobility. So it's something that you guys want to do at home, or if you have a practitioner in your area, that's great. The at-home ones are cold lasers. They're lower level. The ones usually that you go and have a practitioner do it, those are usually much more expensive, higher level, but still, they're both lasers. They both can be beneficial for inflammation. But you can't stop there, because you still need to learn step 2. Step 2 is you need to modify your pet's exercise program. So just imagine you have a little bit of dysplasia. Maybe you're part German Shepherd, maybe you're part Bulldog. Did you guys know that French Bulldogs and English Bulldogs, they have hip dysplasia just normally? It's pretty normal for their hips to be completely out of the socket, just genetically. If you have any of those breeds, you want to just think, wait, I have a young dog, his bones are starting to form, his growth plates are closing, but they're not closed yet. What type of exercise you're going to ask your dog to do? So should we do swim therapy, which is no concussion? You're getting lots of great hip movement, but you're not getting that concussive action that you get when you go on concrete. If you have a young dog under the age of 2, you want to watch how much exercise you're actually having your dog do. You know, it's one thing to take a walk, but it's another thing if he's attached to you with a leash and he has to run to keep up with you, or he'll even outdo you, right? He'll be out in front, but then the next day he's limping. But you can't stop there, because you still need to learn step 3. Step 3 is choosing an anti-inflammatory diet. So every pet, for every pet, that's a different thing, right? So some pets have allergies to certain things, and then they have more inflammation. They might have inflammation when they eat fish or chicken or beef or grains, and then the next pet doesn't have any inflammation with that. And why am I talking about food allergies when we're talking about arthritis and hip arthritis? And that is because more inflammation in the body can create
more joint inflammation. It can create a situation where every single day the pet has inflammation. And what does that look like by the time the pet is 8 years old, or not even really old, 9 years old, maybe even 10 years old? So what we're going to try and do instead is find the right diet for your pet. So if you know your pet has an allergy to foods, please don't feed them. If you know that your pet, if you don't know if your pet has allergies, that's okay. What you want to do is try and go with as much as you can with a meat and vegetable based diet. It doesn't mean potatoes are bad. Sometimes potatoes are fine. We usually recommend sweet potatoes. So we'll do different diets. We'll do a meat, sweet potato, vegetable diet. We'll do a meat, quinoa vegetable diet. And those don't necessarily cause inflammation. But if you notice that your pet has more red skin or pink skin after he eats a certain food, then you're going to want to not feed that food. So it affects not only the skin, but it also affects the joints under the skin. Inflammation can be helped by omega-3s. We know that from loads of research. But most people think omega-3s, fish oil, and I want you guys to think omega-3s flexible. My thoughts are flexible. So we might have a plant-based omega-3 for our dogs. So my favorite one actually is evening primrose. Evening primrose has the best omega-3s out there, and it's very, very good for the joints. So I use a high dose of 1,000 milligrams per 40 pounds of body weight once a day. We can use flax meal, we can use black currant oil, we can use evening primrose oil, we can use fish oil. Even greens, so like collard greens and others, have high levels of omega-3. So do your research, see what your pet does better with. Remember, no one knows your pet like you. So we have 2 more steps. The last step is the most important, but I'll need you guys to hit that subscribe button and share the love. Let us know how your pets have done with hip dysplasia, hip arthritis. There's so many dogs out there, and I'm thinking of this one dog named Finn, German Shepherd, genetically prone hip dysplasia, limping really pretty bad at 2 years old, was going to do surgery, switched to a completely raw diet, switched to a high level chondroprotective diet, so a lot of ligaments, a lot of tendons in the diet of the different animals. And that dog's hip dysplasia, the symptoms of the hip dysplasia went away. And this reminds me, really for his whole life, he became, even though you could x-ray him and still see the hip dysplasia, you couldn't see him in his daily life. He could take a 2-mile run every day. It was no problem. Once they switched the diet to an anti-inflammatory diet for that dog, it was like curative for his hip pain. So how is that? How can hip pain, when you see an x-ray and it doesn't lie, how can that not correlate with the pet, right? So we have this odd thing in medicine where sometimes you can take x-rays and it can look terrible, and you look at the pet and you're like, they're not that bad, but the other side could be true too. The pet's limping and looks terrible and the x-rays don't look too bad. So we have to use x-rays along with what we're seeing clinically to make sure that we're choosing the right diet, the right lifestyle, the right exercise program, maybe even the right anti-inflammatories, whether they're herbal, whether they're conventional. Step 4 is pain control. So I'm going to talk about conventional pain drugs, and I'm going to talk about herbal pain drugs. The first thing to know is that if your pet has been diagnosed with either hip arthritis or hip dysplasia, I want you guys to just double up on the vitamin C. We do 1,000 milligrams of vitamin C per 40 pounds of body weight daily. And we also add all the other antioxidants. So we might add a little bit more vitamin A and D. We might add a little bit more vitamin E. We might add our vitamin mineral mix. You guys know how to make that. So take care of the joints nutritionally. So let's talk about the drugs. So when you go to the vet and your dog's limping, they're going to want to suppress the limping, to stop the limping, so that you can keep making poor choices for the dog, and then the pathology just gets worse and the inflammation just gets worse. It's just being suppressed. In some cases, when the dog is old and you're just looking to have the dog be comfortable, I can completely understand using medications. So we have Galliprant, we have Duramax, Carpafin. These are like NSAIDs or non-steroidal anti-inflammatories, so they can have side effects, right? So you can have ulceration of the GI tract, liver and kidney problems. This is why, if at all possible for pain control, we try to use acupuncture, right? It's just been studies, there's been so many studies on how acupuncture helps pain. And if you guys are interested in talking about that, I'm happy to talk about A fibers, C fibers, pain control, inner neurons. I just don't think you guys want to talk about that. But if you do, let me know. So the other thing that helps with pain, other than acupuncture and keeping the ligaments and tendons strong, so through swim therapy or through even hydrotherapy where they're in a treadmill, those things are awesome. The other thing is herbs. So I use corydalis root tincture, I'll use wild lettuce tincture, I'll use bone set tincture. I have a whole video on bone set I've done for you guys. And so natural pain control and wild lettuce, these are things that help with pain, but they don't have the side effects that non-steroidal anti-inflammatories do. They don't always work as well, but they do work, especially over time. So for example, if you are worried about your pet's hip dysplasia or hip arthritis, then what you want to do is start the herbal formulas, 1 drop per 10 pounds of body weight twice a day of each of the herbs. So wild lettuce, corydalis root, bone set, and another one that helps a lot is California poppy. And we put them in a little tincture for the pet and do 1 drop per 10 pounds of body weight twice a day. And we can put that right in the food. And it's super safe, but you just have to make sure it's effective enough for your pet. You know, you don't want to use herbs and chondroprotective agents and acupuncture only if your pet is still hobbling around. If the arthritis is that bad, you're going to need some medications or you're going to need some surgery. I'm not against that. I'm just against that as being the only treatment for hip arthritis. Can't stop there because we have one final amazing step. Step 5 is chondroprotection. So what does this mean? It's such a big word. What it means is you're giving the pet a supplement, either injectable or oral, that helps with lubricating the joints. It helps with the preservation of the cartilage between the bone. And so what happens if we get bone on bone, we get a lot more pain. But we can offset that, we can prolong symptoms of hip dysplasia and hip arthritis by using chondroprotective agents. So glucosamine sulfate is the most famous one. And remember, that's quite a bit different than glucosamine HCl. Glucosamine sulfate's a lot more effective. It's usually a little more expensive. Neither one is very expensive. You might easily use over 2,000 milligrams for a bigger dog. And so glucosamine sulfate's an excellent joint lubricant. So it's much better than chondroitin in my experience. You can get it either with MSM or without MSM. You guys know that MSM, methylsulfonyl-methane, is not natural, but it's an anti-inflammatory. It comes from the old DMSO. A lot of people, maybe even that DMSO is having a resurgence. It's a chemical solvent, so it's from the chemical industry. But MSM is a derivative of it that's very inert and very safe. The only thing it can sometimes do is loosen the stools, kind of like vitamin C. Use MSM along with glucosamine sulfate to lubricate the joints and help with inflammation. And again, at pretty high doses, with the only side effect being possible diarrhea. The other choice you have is if the veterinarian or you want to go ahead and start doing injectable chondroprotection. So that might be like Adequan injections or chondroprotect injections. I found that Adequan's pretty effective. I think it works better IM than sub-Q. Pet caretakers are giving Adequan sub-Q, and I think if you can, have your veterinarian show you how to do an IM injection. It's not any more difficult. In the diet, why wolves don't have to go and buy chondroprotective agents is because when they eat the ligaments of the prey, then that has natural chondroprotection. Thank you guys so much for watching this video. Remember, subscribe, tell your friends, share, comment. You know, even if you just say, hey, great video, or anything like that, it helps us a lot. If you love this video, you're gonna love this one, which outlines holistic solutions, do's and don'ts, for mast cell cancer.